So I think it's kind of important to actually show a face to who is affected by states who have opted out of Medicaid expansion, which is why I'm going to make this video that hopefully shows what Medicaid expansion is and also why it's really needed for a lot of people. For starters, Medicaid expansion was the idea that in the Affordable Care Act, people making poverty wages or below would be able to automatically qualify for Medicaid. And then people who made about at poverty line to 400% above poverty line would be able to get subsidies towards their health insurance. But what happened was when the government shut down, one of the controversies was that provisions of the Affordable Care Act were trying to be plucked out. And one of those was that the states could now opt out of offering Medicaid expansion. That means that for the 25 states that opted out, Medicaid is only for people over 65 or people who are legally disabled. What that causes is for the people who make poverty wages or below to not get Medicaid and also to not qualify for any tax subsidies. So literally the poorest people are the ones who are having to pay full price for their health insurance. So there are going to be some people who watch this video and say, well, those people should work harder. But that's really difficult for a lot of people. For instance, people my age, like in their early 20s, don't have that option. A lot of us are students. A lot of us are not able to get full-time jobs. So a lot of us can't work more hours because those jobs just aren't available. We don't have a way to make enough money to get out of the poverty gap. The Affordable Care Act made it so that you can actually stay on your parents' insurance until you're 26. But if your parents can't afford insurance, you're not going to get it either. But I was talking about how there's a coverage gap. And that's the people who make nothing up to poverty level. And they're the ones paying full price for everything. So I'm going to try to put this into terms that are a little bit easier to understand. So say you have a community where there is a supermarket that everyone goes to, except for a lot of people who are really poor in the community can't afford to get their food there. So say they save up as hard as they can just to get some staple items, or they're trying to grow gardens in their backyard because they just can't afford to get that food. So they're skipping meals, they're not getting proper nutrition, and it's a big problem. Now say that community decides we're going to make a food pantry and everything is going to be free there for the poorest of the poor. And then everyone who's also still struggling but isn't that poor can get tons of coupons and sale price items at the store and buy generics. Sounds great. Except for then the community decides, someone got pissed off about that, so sorry bro, we're not going to even open the food pantry. So all the poor people are going to say, well, I guess can we try to get something at the supermarket? You know, maybe still get some of those coupons or something. And they're like, no, the coupons are for the other bros. Y'all have to buy everything else. And they're like, but we can't afford that. They're like, well, sorry, you have to go buy the organic stuff and the name brands. That's kind of what just happened with health insurance. And one, like I mentioned, it really sucks for people who are young or people who can't work full time. Two, it really sucks for people who are disabled but not legally disabled. In my case, I'm disabled and chronically ill, but it could take up to 2 years for me to even get on disability if that would be possible, because it's really difficult to get on disability. I don't have the ability to work full time, and I'm already working and going to school, and it takes everything out of me. And yet, legally, I'm not disabled enough to qualify for any help under Medicaid. And I'm not the only person who's like that. I know tons of other people my age who are having problems because they can't work enough hours, or because they're disabled, or because they just aren't qualified to get jobs that actually offer insurance. So what I'm asking you is to please support Medicaid expansion, because it's literally the only chance the poorest of the poor have to get their health insurance. Right now, literally half of my salary goes to healthcare and the other half goes to student loans. There's no way I can support myself. I can't move out of my parents' house. I can't even go to school full time right now. It's just nothing is an option. Everything is deadlocked. And that's really not helping the economy if you're looking at it that way. Hospitals are going bankrupt because people are not insured, and they have to take all of those uninsured people anyway and give them health care, if they're dying and in the ER. So it's not good for hospitals. Another thing is, if you expand Medicaid, the federal government matches it, and you're going to save money in the long run because you're going to have healthier people. And if the economics of it don't sway you to go with it, God, the humanitarian aspect should. How is it right? How does this country think that it is right that you don't deserve to be alive if you don't make enough money? I don't understand how somebody can think that certain people's lives are worth more based on their monetary worth. Because when I think about it, I'm giving back a whole lot to society. I'm getting my master's in gerontology. I work with dementia patients. I volunteer. I do as much as I can. So why is my health, why does it not matter? It's time that we stop pretending that people don't deserve health care just because they can't afford it. And it's also time that we stop pretending that it's not economical to give people health care, because when they are getting health care, they're able to actually give back more to society and the economy. So please, if I can stress anything, it would be that we need to expand Medicaid. Those 25 states that opted out are not helping their people. If you live in a state like mine, which is Missouri, tell your representatives, tell your senators that this isn't right, that people deserve to have health care and they deserve to be able to pay for it. They deserve to be able to eat and heat their homes and, pay off other debts without having to worry about what they're going to do if they get sick. I want my senators and my representatives here in Missouri to see the face of somebody who's not able to get health insurance without help. I want you to see that there are great people out there who just really need help, and denying them of any help in getting health insurance is not going to help lift them out of poverty. It's just going to keep them trapped there longer. People are so worried about having, big government or socialist healthcare, but why aren't we worried about the fact that if you don't have insurance, it can cost up to $200,000 for a procedure that otherwise costs like $1,000 if you did have insurance? Why aren't we worried about the fact that the number one way to get bankrupt in this country is from healthcare expenses? And why aren't we worried about the fact that there are even young, healthy people dying of diseases that are easily avoidable because they don't have proper care? We need good health insurance. We need affordable health insurance. And we need to start saying that people in poverty matter and that people who don't make enough are worthy. It's time that we stop saying that how much you make depends on how much your life is worth. Because we are all people. We're all in it together. Let's start acting like it. Expand Medicaid, because it's the least we can do.